Welcome to Health Live at Seniors Today. We are delighted to have here with us a doctor who's going to speak to us about a different kind of a theme. I was myself surprised about the possibilities of dental treatment for senior citizens, and specifically relation to body pain and how jaw alignment can help resolve problems. Without any further ado, I must introduce you to Dr. Shailesh Divecha. Dr. Divecha has been a dental surgeon for over 4 decades and practices in Mumbai. A Bachelor of Dental Surgery with a Postgraduate Certificate in Current Concepts in American Dentistry and Advance Implantology from Germany. Dr. Divecha is a fellow and past president in the Indian Society of Oral Implantologists from 2011 to 2013. He is an accredited member and past president of the Indian Association of Aesthetic and Cosmetic Dentistry and a fellow of the Smylist Academy in Budapest. It's his burning desire to relieve people from migraine, like headache, neck and shoulder pain, and various types of aches which arise from malalignment of the upper and lower jaws. We are delighted to have you here with us, Dr. Divecha, and welcome to Health Live at Seniors Today.
Well, thank you very much.
How, this is a question which I ask everybody who comes here. Is there a genuine fear of the, well, this is not a question which I ask, but I'm generally a COVID-related question. How do you find the situation today? We are in a city like Mumbai. We've got a rationalization of the levels. So is there a genuine fear? What are you here?
The fear is there, obviously, but now we have learned how to deal with it. There was a time nobody knew how to deal with it. Now we have how to deal with it. And if we do deal with enough concentration, I'm sure we can manage all this.
The worry is that we know how to deal with it, but we are not dealing with it well enough.
That's true. That is the problem. Because I see people around here and the way they behave, as if there is nothing like Corona.
Right. And how
it's very unfortunate. It's very unfortunate because when you see China is completely free now, because they are very strict over there.
Right.
And here people take everything for granted.
And as the dental surgeon, you obviously need to take a lot of care about people coming in and etc. So how do you manage to ensure that you keep the virus off?
In every time, every patient comes, first we sanitize the patient also. And entire clinic is sanitized every day by fumigation. As well as in between patients, we do sanitize in rooms, the equipments, everything is sanitized. And whenever a patient comes in, we do not allow patient to go into the operatory. Everything is done outside, giving gloves, shoe cap, and shoe cover and a head cap. Everything is given to patient so that patient doesn't touch anywhere in the clinic. And after that, once they go, again everything is sterilized again.
So let's get into the topic of the discussion in terms of dental concerns for seniors, plus the topic that you want to concentrate on, which is how jaw realignment can help the various aches and pains, especially migraine and backache, etc. So over to you, and you have a short presentation which you would like to make. And those who have questions, please put them up in the Q&A tab. And yes, there's a namesake of yours, Dimple Divecha, is she asking, is it a COVID discussion? Well, COVID is taking up so much of our mind space. So, and since we have very senior doctors coming over as guests, it's only a good opportunity for us to get some nuggets of advice. So, but we are getting into the dental territory now. So over to you, Dr. Divecha.
Thank you. Good evening, everyone. It gives me immense pleasure to give you something different, what you expected. Normally, dentist means people think that, yes, today and how to brush, how to clean your teeth, how to take care. But nobody knows yet, or very few people know about it, that lot of your body pains are because of wrong alignment of your jaws. And if your jaws are not aligned properly, you can have pain like migraine like pain, you can have shoulder pain, stiffness of the shoulder, back stiffness, and I don't want to say that all the pains are only because of this. There are genuine problems also. But approximately you can say 50% of people have the problems mainly because arising from the wrong alignment of the jaws. Let me clear with certain things that I will just do a small presentation, and in that you will know what people who have been treated and how they feel about it. I would like to share my screen. Hmm. Yeah.
Can you just
It
make it larger? Can you just make it larger, which is
is full screen.
okay, all right.
Is it okay now?
Yeah, it's okay. It's okay.
Yeah.
Yeah.
I have been practicing for last 43 years, and this has been my subject to more specialize about it for last more than 12, 15 years. And more I want to learn about it, how I can help people. You can see the presentation.
I'm Sharifa. I'm Sharifa.
One.
मेरा नाम शालिनी देसाई है। मेरी दोनों बाजू की दांत बहुत साल पहले निकाली थी। 2015 में मैं डॉक्टर शैलेश दिवेचा के पास दांत लगाने आई, तो मेरे दांतों को देखकर पूछा कि मुझे सर दर्द या शोल्डर में दर्द है या नहीं। मैंने कहा मुझे माइग्रेन की बीमारी 2008 से है और उसकी दवाई भी मैं लेती हूँ। डॉक्टर ने मुझे बताया कि मुझे माइग्रेन नहीं है, मेरा दर्द रॉन्ग बाइट की वजह से है। डॉक्टर ने मुझे रात को दांतों पर लगाने के लिए डीप्रोग्रामर दिया, जिससे मेरा दर्द थोड़े ही दिनों में बंद हो गया और मैंने दवाई भी बंद कर दी। उसके बाद डॉक्टर ने दोनों साइड के फिक्स ब्रिज बाइट सही करके लगा दिए। तब से मेरा माइग्रेन भी बंद हुआ और दवाई भी बंद।
Now this lady had come to me in 2015, and she was taking medications also for migraine, and now today, after last 5, 6 years, now she is completely off pain just by aligning her jaw in a right way.
I'm Sharifa Sidat. I came to see Dr. Shailesh Divecha from Zambia through my gynae's reference. When I got a dental checkup from doctor, he asked me if I was suffering from any headaches, neck or backache, and I told him yes. I have been living with pain from head to toe since about 20 years now. Doctor explained me the connection of my pain with my wrong bite. He gave me a deprogrammer appliance to wear during sleep. During my stay, I had already consulted a spine surgeon, and with help of an MRI, I was advised spine surgery in my neck area and lower back. Within 8 days, I had 90% relief from my spine. So I came from Zambia 3 times for 2 weeks on each trip and got correction of bite with added benefit of a new beautiful smile. It's been 1.5 years now since my treatment began. Body pain is now a history.
See here, again, she had basically come for her husband treatment for other implants. And when she said just for a checkup, when I saw her teeth, the way the teeth are wearing out, and that is what is important. When you have a wearing of teeth and typical of not aligned properly the jaws. And if you see her face, it is not a question of what teeth have now, but see her face, how worried she was, and what was the tension on her face as well as her eyes, her muscles were different. And see, after the treatment, after 3 months, her entire face has changed just because of proper alignment.
Since the past 10 years, I've had a back problem and I have tried physiotherapy, I've tried alternative treatments, nothing has helped. About 2 years back, Dr. Shailesh Divecha realized that the pain might be due to a misalignment of my jaw. He put me on the deprogrammer, which helped relieve the pain a lot. For the past 2-3 weeks, I was in a lot of pain. I was putting pain relieving patch and oils and things, but nothing was helping. But last week, once he aligned my jaw, my pain subsided me practically immediately, and now I am able to touch my feet, bend, and do all my exercises, even boot camp, etc. After this alignment. Thank you, Dr. Divecha.
Now this patient had problem, she could not bend down, and all the same time, she could not lift her grandchildren. Now she can do everything just after the treatment is complete.
7-8 साल से मुझे सीने में, पीठ में, पीछे पीठी में दर्द शुरू हुआ। जब असहाय हो गया तब अस्पताल भर्ती करा के पूरी जांच की, पर कोई फायदा नहीं हुआ। 8 महीने पहले जब मैं डॉक्टर देवेचा के पास दांत घिसने की वजह से दांत बताने आया था, उन्होंने दांत देखकर बताया मेरा दर्द जड़वे सही नहीं मिलने के कारण हो रहा है, और उन्होंने ट्रीटमेंट शुरू किया। बाद में थोड़े दिन में मेरा दर्द गायब हो गया, अब एकदम दर्द ठीक है।
Now let me explain you how it happens. Our lower jaw is aligned in such a way that it fits properly into fossa here of the joint. But if it is not in that time, your teeth should meet properly, upper and lower teeth meet should properly. Now you can see this patient is suffering for 40 years with severe pain, and if you see, this is how his teeth were meeting. But in an actual way, the way if he align his jaw properly, only 2 teeth were meeting at the back. And the body, the mind sees the problem and tries to adjust your jaw in such a way that most of the teeth meet. But this causes the muscles to go into spasm, and that spasm can go right from the head to the lower back. So there are people who suffer only from headache, or there are people who suffer only back problems. Some people have only shoulder problem, or some people have full. Like the previous lady for the she had problems right from head to toe. Because of the muscle spasm, the vertebrae come closer, and vertebrae come closer, so spasm when the vertebrae come closer, the nerves which is passing between the 2 vertebrae is pressed. So you can get sciatica kind of pain also. So now this she was advised actually for after MRI that she needs spine surgery. But in 10 days, she was feeling so better, 90% with the just deprogrammer, the appliance to wear at night. So she knew the problem is not in the spine. And that's why she came all the way from Zambia 3 times. And we relieved her all the problems. Now this gentleman, 35 years old, 11 years with restricted neck and arm movement. This all he could lift his hand for last so many years.
Right.
Yeah.
Here you can see how much pain he has. On the left side, he could not move even half of his neck movement. See the amount of pain he is going through just to bend his neck. Okay, and I have deprogrammed his muscles. I put certain deprogrammer in his mouth for left it half an hour, and after half an hour, you can see the change. Think of a person who is having so many problems, and in half an hour, the whole problem is relieved. And if you see this movement, neck movement also. See, you can move to left side almost full. Now, this was just to make patient aware of the problem. I have aligned his job temporarily. Later on, we have to decide the line of treatment and do a further treatment properly for permanent solutions. See from where to where. You will see here, because of all the upper teeth are completely covering lower teeth. You can't see the front lower teeth at all. The way the teeth are wearing out, you can see they are breaking also. And now you see after treatment, the whole alignment is done. You can see lower teeth also, the teeth have changed completely. Even this patient, you saw his teeth and see the difference after some time. So I do not still want to say that every time the problem is because of the jaw alignment. But yes, if they have problem, if the problems are there because they neck stiffness, and more especially in the early morning, what happens here that whenever we swallow saliva, at that time we need to clench our teeth tight. If our jaw is not aligned completely normally, and the jaw is aligned because our mind has changed your position, the jaw, the muscles go into spasm. Your daytime you don't realize, but when you sleep at night, the jaw tries to go back to the position where it should be. At that time, you cannot clench because the teeth don't meet well. And in that case, every time you swallow saliva during sleep, the jaw shifts to come to clenching position and swallow the spit. So that itself gives spasm. And throughout the night, and when you get up in the morning, you might have headache, you might have stiff neck, you can have stiff back, or you might have a stiff shoulder joint. So all this, if you are early morning when you get up with this, you are definitely sure that it is because of wrong alignment of a tooth. Because normally they say that you have back problem, you have any problem, you rest, lie down. Or here after lying down you have problem, that means the problem is in the alignment of jaw. I'm open for the question answers. 1 minute. We'll stop sharing now. 1 minute.
That's fine. It's not sharing now. Thank you very much, Dr. Divecha, for a presentation that has answered many questions and also raised quite many questions. There's a question that has come in from Chitra Khandikar, who says, how does one come to know that jaw alignment is not proper?
No, that's what I have to do. Especially in the morning, if you have problem, you are 100% sure it is jaw alignment problem. Otherwise, also like many a time patients don't know about it. Many a time patients are so used to that stiffness, mild stiffness, that they don't know that for them it's normal. So this is all. First thing I would like, if anybody has problem, to see a specialist who does this. So that once you see, now I can say when I feel, no, it's not because of alignment, I can tell patient, no, it is not when you go to your orthopedic surgeon. I have seen people who have been suffering and taking physiotherapy for so many times. Like that lady also who could not bend, or she had taken all the possible treatment. And when she came to this mention with the problem, see, years before, I never used to ask anybody. But the more I know about it, when I see the teeth being worn out, I ask the patient, do you have this problem or not? So if they have problem, I can try and help them out.
That's right. As Devendra Gada, who is one of our regular attendee says, "Wow, it was amazing." So it's obviously, not too many people knew about the message that incorrect alignment could send out, and people are not aware of it. We have a question from Mr. Bridge Dugal, who says, "I'm 76, male. I have lost most of my upper teeth prior to the pandemic. I'm having a backache since then. How do I check my jaw alignment? Presently, my dentist is making my denture."
Yeah, but when we make the denture properly, if the jawline is completely done, then he will not have pain.
All right.
See, when we take the relation of upper and lower jaw while making the denture, this has to be taken into consideration that the height is correct, the position of jaw is correct, and after that, if you make the denture, you should not have a problem.
Now, Doctor, there's a question from Damasceno of Santa Maria, who asks, "Is tooth decay hereditary?" That is the only problem.
I didn't get the question. Is
tooth decay hereditary? And he says that is the only problem I face through life. So that's his question. Are tooth decay hereditary? And
I know, no. Tooth decay is basically infection. It's a kind of thing where if you do not clean well, huh? One thing can be if your basic structure of the tooth is not good, you are prone to decay. That is different story. But decay will never come as a hereditary.
And his other question is, are mouthwashes a good bet?
Very dubious question. Our mouth is, no, I see, though I'm a dentist, but frankly speaking, that you can see all these companies coming. Today, they were saying that the charcoal should not be used. Today, they come with charcoal toothpaste. For them, it's a gimmick. They want to sell their product somehow. They keep changing the things. Now, all the oral, what we call a microbial oral flora, there are 300-400 different kinds of bacteria in your mouth all the time. Do they really trouble you? You are not aware of it also. So, what is the point in killing them every 12 hours? This is my frank opinion. I do use mouthwashes only when I do surgical work, when I want that there should be infection in the surgery.
Right. We have a question from Dimple Divecha, who asks, when one clenches one's teeth, when one clenches the teeth, is it recommended? It is important to use upper guard or lower guard, although any guard is like a sandwich. When one clenches teeth, so guard is recommended. You, the dentist, is it important to use upper guard or lower guard, although any guard is like a sandwich? If upper and lower guard used at the same time, it may give misalignment of jaws.
See, the most of the time, the guards which are used are soft guards. Okay, I don't think I have used soft guards for the last 15-20 years. For the simple reason that the moment the things come into your mouth, you try to chew on it. And the whole alignment problem is because you keep chewing on it, the muscles go into spasm. Guard will help you not to grind away your teeth. The guard will get worn out. But the thing is, if you align the jaw properly, you will not do clenching.
Right. We have two questions which are similar. One is from Mr. Santa Maria, and the other is from Bridgeratan Mundra. What is the approximate cost of the treatment?
It varies. I have a patient who had come for certain bridge work, and he had one tooth in the center of the palate here, extra. And that was interfering his movement, but he never knew. I think let me go through it. I'll show you that patient's thing. I'll show you. Now, he had come for a work which was to replace the teeth. But what happened here, that one tooth was coming in his way and his jaw was shifting. So I told him that this tooth is actually, and I asked him whether you have problem of a shoulder. He said, yes, I'm a driver. So all these years I've been driving. So my problem is that I have a lot of stiff shoulder. I explained him to the thing that this one tooth is causing all your problems. He did not agree with it. I don't know, remove. I said, remove, it's a useless tooth. So then I tried, what I did, whatever interfering part was there, I just ground that off. So now his jaw has gone into actual position where it should be. Within fraction of minute, he said, my entire body is free now. And this is almost 2 years now. He doesn't have any problem. So treatment depends on what is the problem. Every patient what I showed was there different extreme cases. But there are people whom I have just done little bit grinding of the teeth and align the teeth, and they feel more. Recently, I had a patient in COVID time only. So she was suffering from stiff shoulder, like there was a big weight on her shoulder. And when I did her alignment properly, just by grinding away the teeth, next morning she said, my entire load of the shoulder is gone now. So it depends on individual where the problem is, how much severe it is. So I cannot say that this is a treatment for everyone. No.
Right. We have a question from Madhukar Choksi.
Yes.
Says implant done within 48 hours. How safe is it?
See, all these implants, if the infection is controlled well, then it is safe. We do immediate also for 48 hours. We extract the tooth and put implant at the same time. But one has to be sure that there is enough bone, and one has to be sure that there is no infection inside. If there is not enough bone, you try to do, it is going to fail. So as a rule, you cannot do for every case.
We have a question from an anonymous attendee. She says she's asking on behalf of a lady who's 77 years old. She's going through implants and is having immense body pain and jaw swelling. The left side was done first and went off very well. And later the right side when the pain is not subsiding. What could be the reason and what steps can be taken to mitigate the pain?
See, without knowing the truth, it won't be a right thing to answer this. But I can say one thing, that possible chances there can be some infection.
Right. We have a question from Devendra Gada who says, his question is, what treatment have you given to your patients that you showed in the presentation?
See, all this what you show is basically all full crowns, because the entire jaw alignment was different. The distance between upper and lower jaw was different. You could see that lady patient that you could not see the front teeth at all, lower front teeth, because the entire tooth, the upper teeth are covering the lower teeth. But then I have to actually raise her bite. Now, if I raise the bite completely, the entire thing has to be reconstructed. So all these teeth, every tooth has to be remade completely by ceramic or whatever requirement is.
You know, we have two questions, and I'm sorry, there are these questions that are being asked, and I think it's only fair that I put them to you. There's one question from Mr. Ashok Mehra, and there's a question from Mr. Dilip Dalal. So Mr. Mehra says his age is 75 and implant 3 teeth, what will be the cost? And Mr. Dilip Dalal also asks, what is the cost of implant per tooth?
The implant itself, by say, can cost from X amount to 6X amount, implant cost, depending on what kind of implant it is, what company it is. So it's very difficult, and there are certain situations where you need a particular type of implant only. So it's not right, because normally, yes, around 40,000 approximately for a reasonably good implant, and a tooth on it later on, whatever is required.
Right. So yeah, I think that's a fair indicator that it will be around 40,000 is what it is. Doctor, there's a question from an anonymous attendee who says, if you don't use dentures, will it have an adverse effect on the bones or otherwise?
It will have complete reverse on your complete health. Because as your age advances, your body system slowly becomes slow, right? Your body, you cannot digest the food the way you are digesting when you are young. And if, how do you help it? By chewing the food properly so that your body gets good nourishment. And if you do not have dentures, then what will happen? You can't, you are just gulping the food. You are not chewing it. How do you expect it to give you full nourishment? So it will affect the entire health of the body.
Doctor, there's a question that has come in which says that from an anonymous attendee once again, says, doctor, if one goes to an orthopedic surgeon, the doctor doesn't tell us that the reason why the pain could be there is because of an incorrect alignment of the jaws. Why is that so? They should tell us, right?
Let me tell you, this particular branch is not known to them. Like people who I have recently one patient, she's around 80-year-old lady, she had come for her treatment. And then she told my maid servant who is with me, attendant, she is having dental problems, so you please treat her. When I saw the teeth, I said, there's no problem in the teeth at all. The problem is this alignment. And I asked her, do you have a headache? She said, yeah, I've been taking migraine medication. And that was done by, after all the investigations, the neurophysician had given her medications. Now she was taking 2 to 3 times a day those medications. In spite, she used to get still pain sometime, and she used to have crocin or other medication for that. The moment I saw, I said, no, the problem is not that. The problem is because of your wrong alignment of teeth. I gave her a deprogrammer to wear at night. And I said, you stop taking medications. And from day onward, now it's almost 4 months, she has no pain. So they don't know about it. So I won't blame them. No, because they don't know about it. And even in dentistry, how many people really treat all this?
So would you say that if a person has chronic backache or migraine, etc., they must visit, or consult a specialist like yourself, so that they can at least perhaps
yes,
get a possible solution for their problem?
Exactly.
Surgery.
See, if it is not because of dental alignment, then I can see immediately. And whatever we give the patient is basically totally non-invasive, just to find out, to confirm diagnosis. Like the deprogrammer, if I give, the patient feels better, that means it's a problem of this. Now that lady could not have afforded the full treatment charge. But just by wearing at night that deprogrammer, she is relieved, no? My job is done. I don't have to do everything for every patient, depending on patient's wants. Now, patient doesn't want the problem and you want a permanent, proper solution, then you have to go for a full treatment. Whatever required as per the individual mouth.
Right. We have a few other general questions, which are, one of them is from Satish Kalia. He says, I'm 76, I have a broken tooth just close to the gum. No pain as such. Can I carry on without any other damage to the health or body?
Close to what? Sharp edge tooth, broken tooth, close to?
Close to the gums.
Okay. If it is sharp, then it may hurt your tongue, may not realize, but then it can lead to cancer. It can. Or it can, suppose sharp is touching the cheek and all the time cutting there, you can have non-healing ulcer and it can lead to cancer. I don't say everyone will get, but it's quite risky. And many times the problem is we all are guided by pain. If there is no pain, I'm all right. No. A lot of people come to us and when they find that there are so many cavities, I know a person who had so much of abscess, whole cyst was lying inside and the patient had no pain. So pain is not a criteria to judge the problem. That is why I always advise patients 6-month checkup so that anything is there in early stages can be caught early treated early, less time of treatment, less invasive, and less cost. The more you wait, the more the problem.
Absolutely. Doctor, there's a question which has come in. It says, I have uncle in Pune who has a backache and I want him to verify this. How can one get a consultation with you, or are there specialists who do this, who do look at it in a city like Pune?
I don't know about that. See, because the way I work now, like you saw that gentleman who could not lift his arm at all, and within half an hour of alignment. So that particular thing I learned in Budapest. That's where I'm a fellow of Smylist Academy, because I have worked as per their requirements and I've done certain things. So I've done some cases. All these cases, what you saw, are done as a Smylist way, and in that is totally different than normally what we should do before. So
But
that alignment is done, and you put some wax and align the jaw. Wait for half an hour, and half an hour patient finds better. Now that is a very dramatic change.
but for that, one has to visit Mumbai and visit you.
Unfortunately, yes, I don't know about it, who does it over there.
But do you, is a teleconsult a good idea to do first, or should one just come and visit you?
Come and visit, because see, how much can I see from this? See, your body posture, how you sit, how you stand, what are your muscles here working? I can see from your face. But I need a posture, how you are standing. All those things is very important.
Right. We have a question from Mahavir Hazare, who asks, will you please advise whether we should go for a fixed permanent denture or removable denture, which has more advantage? And there is another question which has come in, which is the combination of implants and dentures fine, or should it be only implants or only dentures?
Okay. Now, first question, dentures are dentures, they are removable, basically removable. If you want to put fixed denture, that means you have to put implants. How will you fix with what? The dentures cannot be fixed without implants.
Right.
So unless we are ready for implants, you can't fix dentures. Dentures has to be normally is loose. Now, what happens here? Many a times you have lost so much of bone after the teeth are out. The entire jaw is going inside. Now, in that case, even if you put fixed implant complete and you fix the teeth without denture, you will still on appearance it will look as if you don't have teeth, because you cannot build this area. For that, its best thing is implants and a denture fixed on that. So in dentures, we can make a flange, we can give aesthetic look out also. But with low thickness of the jaw and it's too much inside, if you put a fixed teeth, you will be able to chew everything, but aesthetically it will look as if you don't have teeth. So all these things varies from requirement to requirement of individual.
We have a question from Ramesh Rastogi, who says, I have full denture lower. I have only one tooth at the end in good condition. Is it possible to have lower partial denture?
No, what is partial denture? You need some teeth there to be present. Then it's a partial denture. If you have full denture lower, so it's full denture.
Right. Doctor, there is somebody who's asked, may I have your number and address? What we'll do is we will give your clinic's number to
Sure.
when we write the takeaways. We'll take the number from you and put it down, as well as an address for your office, and they can then get in touch with you. I'm not even going to ask you this question. I don't think it's right for me to ask, but somebody has put it, and I must say it. So, how much does a consultation cost? I think it's best that they.
Consultation normally is 650. Normally.
So I was hesitant to ask you this question, but You were
No,
very.
it's open. It's very open. And everything in my clinic is completely on receipts. So there is no question. We have one particular way of working and we follow that method. It's not that somebody comes, you charge 1,000 and some you charge 10,000. No. Yeah, if patient is very poor, in fact, the consideration is different. But otherwise, the charges are fixed for everyone. Even if a multimillionaire comes, he pays the same amount.
Uh, Thank you very much, Dr. Divecha, for
I should thank you for giving me the opportunity to present my things. But I wanted to do something different than just doing dentistry.
Yeah, no, it was very good, and I think it's something which people don't know about, and it's always good to get sound advice like this. Renu Parekh, we will give you Dr. Divecha's coordinates, his phone number, his email address, and the address. It will be there on the as part of the takeaways that we carry on the Seniors Today website, which is seniorstoday/webinar. So it will be there in that. You can have a look at it. We will give Dr. Divecha's email address and telephone number. Thank you once again, Dr. Divecha, for
Pleasure is mine. Pleasure is mine.
And as the responses have come in, they've been very happy with your presentation, and also throwing light on something that a lot of people weren't aware of. Thank you once again, Dr. Divecha, and we will be back once again with Health Live at Seniors Today next week, that is next Saturday at 5 p.m. Thank you very much.
Thank you. Thank you, everyone, for listening. Thank you. Thank you.